Thanks, David. Well, nearly 23,000 women are diagnosed with ovarian cancer every year. In 2015, my mom was one of them. So here is what you need to know. This is something that is very important to me, and I'm so glad that we have an incredible doctor here joining us from the Cleveland Clinic, Dr. Chad Michener, to discuss this, because this is something that, although my mom passed away from it, this is not a gloom and doom situation, and there are so many women who can thrive even after being diagnosed. So, Dr. Michener, first of all, thank you so much for joining us this morning.
Yeah, thanks for having me, Natalie.
And I know you wouldn't be in this business if it wasn't about some positivity as well. So I would first love, this is a rare cancer compared to others.
Yeah, true. So typically it's about a 1 in 70 risk for women to develop this in their lifetime. So that's about 1.5%. And, there are some familial sort of signs that sort of click that in, particularly a strong family history of breast and ovarian cancer. And that probably accounts for about a quarter of our cases. But 75% of the time, there's no real significant family history. And so that's sort of the downfall. So thankfully, it's a rare cancer, relatively speaking.
When someone, for my mom, I remember it was just her intuition, knowing that there was something wrong. She didn't feel good. Her stomach was distended. How the symptoms tend to be like other symptoms we might have for other problems. It's kind of hard to catch at first.
Yeah, so they're very similar to things people get commonly, pressure and bloating and constipation, changes in urinary frequency. I think really the difference we noticed with cancer patients is that those symptoms start to pile up on people. So they weren't really having them. Now all of a sudden they're having them more days than not. And if those symptoms persist for more than a few weeks, it would be reasonable to have that checked out. But there's not really a specific symptom here. And so that's a little bit tricky. So I think just people knowing that those symptoms are out there and knowing that if there's a sudden change for them, that's really the time to probably mention it to your physicians.
And how, for those who wouldn't know, how are women normally diagnosed?
So oftentimes we'll see patients in the office. So if they came in with symptoms like your mom, we would do an exam, see if there was anything out of the ordinary there. And then oftentimes that leads to imaging. So either ultrasound or sometimes just straight to a CAT scan. And then we'll find, masses, hopefully just a confined mass, but oftentimes, unfortunately, we find more, spread outside of the ovary at the time of diagnosis.
Now, when you're going through this process, there might be someone who was just diagnosed with this and is watching today. When you're going through the process, what is the treatment protocol?
So we spend a lot of time up front when we diagnose a patient with ovary cancer trying to figure out if they should go straight to surgery as sort of the primary mechanism of treatment, or if they may benefit more from upfront chemotherapy. And so that's called neoadjuvant chemotherapy. So with that, we'll give 3 or 4 cycles of chemotherapy, repeat CT scans at that point, and then oftentimes do a surgery afterwards with or without an infusion of chemotherapy during surgery called HIPEC or hyperthermic intraperitoneal chemotherapy, and then finish off with more chemotherapy to follow. And the patients who go to surgery up front, they'll get 6 cycles of chemotherapy afterwards. And then frequently we'll do genetic testing nowadays to see if people would qualify for any maintenance therapies that are available.
And I know that I brought up, and those who have followed me on New Day know that my mom did pass away last year from this. However, I remember going through that process. There were so many women who had reached out who have been living with this for decades, and it doesn't have to be a death sentence.
Correct. Yeah. So with passing time, the research has been great, and we found new treatments that are available. A lot of it has to do with the biology of the tumor, but we're really finding ways around that. So, new classifications of drugs that are coming out, new combinations of therapy that we've never used before. The longer we can keep patients well, the more opportunity there is for them to participate in trials, and then also have those drugs become available as FDA-approved therapies.
Well, and speaking of ways that we can all help in this, there is an amazing run that's happening. It's an annual run that happens. It's called OutRun Ovarian Cancer. It's a virtual this year 5K run walk. And I know you know a little bit more about this. This is an exciting walk they do every year to raise money for things like this research.
Yeah. So the race started, I think, 16 years ago. I think was the first one in 2004. And then since then, they usually will do it in the fall. It usually is at the Rock and Roll Hall of Fame most recently. But this year is completely virtual. So basically this year we're letting people do whatever they want. They can walk, they can run, they can swim, they can bicycle. So really anything just to support the cause. It's really closed off in terms of registration now, but if someone wants to support it, they can go to the OROC website, oroc.org/donate, and make a donation if they want. And that money that they're raising is actually staying local and going to the hospitals that have ovarian cancer programs, Metro University and Cleveland Clinic as well, into research programs and program that support patients and does some outreach for education of symptoms and things that we were talking about this morning.
Well, I know, again, it's rare, but you never know. I never thought my mom would be diagnosed. So you never know if it could be someone that you love. And this is a great organization to support. And so make sure you go to that website if you would like to make a donation. I know I appreciate it very much, as well as everyone else. Dr. Michener, please tell Dr. DiBernardo I said hi. You all wonderful doctors there in that department. We're so blessed to have you here in Northeast Ohio. We truly are.
Great. Thank you so much. Thank you for having me this morning.
Have a great day.
All right. Thanks. You too.
All right, still to come here on